Thank you, everyone. Good afternoon. On behalf of the entire Canopy team, we would really like to thank you all for taking the time out of your day to join us today. And we do look forward to sharing some exciting developments that we've been working on that will assist you all in your practice. So just a little background on myself. I'm Anna. I'm the account executive at Canopy. I'm trained as a nurse and I received my BSN back in Tennessee. I primarily worked in a large pediatric institute during the height of the pandemic, and I personally encountered LEP patients or limited English proficiency patients every single day in my practice. So I now use this knowledge of healthcare system resources and experiences to assist the Canopy development team and to better serve our clients. As does another member of our team, Kylie, who's also a trained nurse and practiced in Colorado while experiencing her own obstacles in adequately meeting her LEP patients' needs. So you will hear from our Director of Content, Dr. Kate Ristenberg, in a moment, but first I'll hand it over to Canopy's founder and CEO, Bill Tan, to shed light on his own background and mission, and we will get things started.
Thank you very much, Anna, for the introduction. And we appreciate very much the work that you have been doing on the front line. And we very much appreciate you joining our team and helping us bring Canopy's innovative products out to the front line of practice. So we appreciate everyone joining us today. We have some very exciting announcements, a preview to share with you for the upcoming release of CanopySpeak, the premium version. Let me begin by giving you a very quick introduction about Canopy and the mission that Canopy is working to achieve. So, as you all know, the language barrier is affecting at least 26 million individuals in the US. And in order to truly bring it under management, we need to find a way to not just keep the language barrier in check, but find a way to truly eliminate it. And we want to do so by providing the frontline clinicians and staff with the right kind of tools. In addition to the use of medical interpreters, it's very important to also have additional resources to cover those points of contact with the patient that where finding an interpreter may be difficult or impractical. And Anna could advance to the next slide. So through the NIH supported work that we've been doing, we have been looking at the language barrier as a very multifaceted challenge. And there are at least 8 different aspects of it that are significant enough that a new kind of approach is needed. And when you look at how we can bring the right kinds of resources to the front line of practice, what we have created in our product roadmap is a set of tools that will help address each one of those 8 major aspects. On the left-hand side, which is where the CanopySpeak mobile app sits, is what we call the professional development bundle. And these include, number 1, the Canopy compliance module, which is a 1-hour training course to help raise staff's awareness about the regulatory requirements surrounding language access. And in Canopy credential, number 2 on the list, this is the proficiency exam to help credential those who are QBS, qualified bilingual staff. And then Canopy Learn is one of our very well-established products, which is an e-learning platform for medical Spanish. And then the focal point of today's webinar is going to be the new release of CanopySpeak. And CanopySpeak is really a product that's created by professionals for professionals. We have had tremendous level of input from the clinical practice community in helping us figure out which medical specialties are important to include, which commonly used phrases are most valuable. And we have created the corpus of 5,000 frequently used medical phrases with their help. The announcement that we're going to be making today is we'll be reinventing language, reinventing CanopySpeak to turn it from a clinical smart phrasebook to also an e-learning personalized learning tool, so that we can take those frequently used phrases and present them to the user as learning targets, so that they can eventually be able to speak those target phrases in the language that their patients speak. We're aiming for a early 2023 release date, and between now and then, there's still a substantial amount of work to be done, and we very much welcome your input. The CanopySpeak premium version is going to be made available as an enterprise resource, meaning institutions, including hospitals, clinics, and other facilities can subscribe to it through a institution enterprise subscription license, and then make it available to the individual clinicians and staff members. So if you're interested in learning more about how to bring CanopySpeak, the premium version, to your institution, please contact us. We'll have the contact information towards the end of this presentation. So without further ado, I'm going to hand it over to Dr. Kate Riestenberg, who is our Director of Content and Pedagogy, in order to give you a sneak peek of what's upcoming on the CanopySpeak roadmap.
Thank you so much, Bill. I'm really excited to be here. As Bill mentioned, I'm the Director of Content and Pedagogy at Canopy Innovations. I am an applied linguist by training, and so that means that I pour my heart and soul into making sure that our products are as effective as possible for language learning, and especially for language learning in specific contexts. So when we do this, we always work backwards from what are the challenges, what are the problems that we're trying to solve, and how can we offer language learning solutions and other kinds of professional development training solutions that really do address the language barrier in healthcare. So CanopySpeak Premium is no different. We are starting from the understanding the types of challenges that we're hearing from healthcare professionals that they're facing in providing comprehensive language services for their patients. So we all know that, of course, this is also related to some of the regulatory requirements around language access. That guidance from the Department of Health and Human Services, for example, requires that any entity receiving federal funding must offer and provide language assistance services at all points of contact in a timely manner during all hours of operation. So of course, in practice, this is really, really difficult, even if we want to be able to provide language services to our patients at every possible point of contact. And the truth is that not every point of contact with a patient is really a good candidate for the use of a medical interpreter, even though we certainly understand and believe that a medical interpreter is the gold standard for language services in a healthcare context. There are so many other types of points of contact with patients where, to be honest, right now, there are gaps. So at Canopy, we're really focused on filling in those gaps above and beyond the use of medical interpreters. Now, one of the things that sometimes happens to try to fill in this gap is the use of machine translators such as Google Translate. And of course, this is driven by a true need and desire on the part of healthcare professionals to find ways to communicate with your patients, which is certainly admirable. However, there have been a number of studies, including a 2021 study by researchers from UCLA and Memorial Sloan Kettering, that showed that Google Translate still isn't really reliable enough to use for medical instructions, for medical purposes, for patients with limited English proficiency. And other studies have shown that even for the most commonly used languages, such as Spanish, Google Translate can still produce mistranslations with the potential to cause significant harm in 2% of translated sentences. And for less common languages, such as Swahili, the accuracy rate of Google Translate for medical language can actually be as low as 10%. So this is still a huge problem that we're facing. It's a challenge, it's an obstacle, and Google Translate or other similar tools are not quite meeting the bar here. So what we're really interested in is taking advantage of the fact that there is a huge, really willing population of healthcare professionals who are already bilingual or who are willing to improve their medical language proficiency to better be able to fill in some of these gaps with patients. And so we really believe that medical language training for healthcare staff, healthcare professionals, clinicians, providers is the best way to fill in these gaps so that as many patients as possible can be treated directly in their preferred language. And we know, for example, that when this is offered, when patients are treated in their preferred language, patient satisfaction is higher, adherence to medications is better, and patients have fewer unanswered questions when they are treated in their preferred language. So that's why a big focus of our professional development suite is on medical language training. Now, sort of the heart and soul of our professional development bundle is our Canopy Learn courses, which are really well established, have been around for a few years now with a lot of satisfied customers. And this includes our widely used medical Spanish course, which is the most widely used online medical Spanish course in the United States. And we also offer medical English through this platform. So what this is an online self-paced e-learning platform with a robust medical Spanish and medical English curriculum. It's tailored for healthcare professionals based on everyday clinical encounters, and it combines medical terms, language foundations, and cultural knowledge together in every lesson. So you might already be familiar with our Canopy Learn e-learning platform. CanopySpeak is what we are talking about today. And this is, you might think of it as a supplement to Canopy Learn in the sense that it's a smart phrase book and a medical language learning app with over 5,000 medical phrases in 15 languages. So this is another highlight of our medical language training suite. And we are excited to be upgrading this web app to better support healthcare professionals in learning, practicing, and mastering all of these phrases. They can choose the phrases of their choice in a way that is personalized for your specific needs in terms of both your medical specialization and the target language or languages that you'd like to learn to be able to interact with your patients. So let's see some examples of how this all works together. So just to kind of recap here, all of our medical language training products are tailored for healthcare professionals based on real patient encounters. So we start with what do you want to be able to do in the language, and we work backwards from there, following the best principles of applied linguistics. Canopy Learn, as I mentioned, offers this sort of 3-level e-learning course with a standardized 40-hour curriculum, so you're working through it lesson by lesson. CanopySpeak is a lot more of sort of an a la carte menu. You have 5,000 frequently used medical phrases to choose from, and you can work through those phrases following a path of your choice. So again, you can choose from around 5,000 medical phrases in 15 languages. You have that real-time reference with audio and text for each phrase. It's all searchable, and you can use it by making customizable playlists of phrases that then you have in your pocket at any time. Our exciting upgrade to CanopySpeak for CanopySpeak Premium is adding on this learning mode that is going to allow people to review, practice, and master any of these phrases of their choosing in any language through fun and interactive exercises. So let's see a little bit more about how we might expect folks to be using CanopySpeak Premium. The patient interaction mode is designed to be used in real time with patients for low risk, highly routine interactions. So these are usually the types of interactions in which few or no language services are currently provided. So in this case, for example, we see a phlebotomist who's using CanopySpeak's patient interaction mode to do a blood draw with a patient in Portuguese. And she can even play the Portuguese audio for the patient to explain what she's doing next. So that's the patient interaction mode. What's really exciting is this learning mode that is part of the CanopySpeak upgrade. And so we see, for example, that if you are an RN who wants to use learning mode, what you might do is use it during your breaks to practice taking patient histories in Korean. So that's what this nurse is doing here. She's using CanopySpeak's learning mode to to work through fun and interactive exercises and games that break down these longer phrases in Korean into shorter, manageable phrases that might fit, for example, on a flashcard, and then working through some of those games to build the phrase back up into the longer phrase that you would need to interact with a patient. And finally, you sort of test yourself by recording yourself speaking these phrases and comparing it to the original phrase. So you can also work through these at any time, in your pocket, and use it as a language learning tool. And the way that you would do this is you would actually create and save your own personalized playlists of any phrases of your choosing. You can organize them how you would like. You can tag them for different things, and then you can revisit them again and again until you feel that you've mastered them. This RN who's practicing Korean can also track her individualized progress according to Canopy's essential skills for bilingual healthcare communication to help her decide what to practice next. So these are a list of essential speaking and listening skills that we've developed that are available in our toolkit at withcanopy.com. And you can see a few examples of these here. So these are things like ask about or discuss patient habits, lifestyle, living situation, symptoms, or history. Explain or discuss test results or a diagnosis. Explain or discuss a treatment or medication. Explain or discuss follow-up care, medical advice, or recommendations. So these are the coming from the list of essential skills that we've developed. And what this allows you to do is tag a playlist within CanopySpeak Premium with a particular skill so that you can really take charge of your own language learning and track your progress over time. So I know this was quick, but we hope that this gives you an exciting first glimpse of what's to come for CanopySpeak Premium. We are really excited about it too. I am going to pass it back to Anna to give you a little bit more information and close us out.
Awesome. Thank you, Kate. Yeah, so looking forward at our next steps here, we are excited to announce that we've officially opened our waitlist for the beta launch of CanopySpeak Premium for your institution. We do have quite a bit of interest from those who have been following our journey towards this launch. So please reach out as soon as possible if you are interested. You can contact us at the email that you see there if this is something that you believe your institution would like to explore further. We'll also be emailing a link to you all after the webinar where you can join the waitlist there as well. On the right-hand side here, you'll also find the link to our website where you can follow along as we add in our additional languages and keep you updated and informed on the latest advancements of CanopySpeak Premium. Additionally, we would love to chat with you more about your specific institution's needs and implementation process, answer any of your outstanding questions about CanopySpeak. So you can use this email here again to reach out to Kylie and myself for more information. But again, we truly want to thank you all for making the time to join us today. We look forward to hearing from you and working with you in the future. So thank you, everyone. We hope you have a great afternoon.